makes up the homeless community? Although this list is not complete in any means, it is important to notice the trends. There are people who are chronically homeless, severely mental ill, chronic drug users, veterans, people with HIV/AIDS, and domestic violence survivors. The sheltered homeless on the left refers to people who might be living with friends or family. They can also be folks staying in shelters. Unsheltered refers to the people we see out in the cold, on parks and benches. It is interesting to note the downward trend of the sheltered mentally ill in 2008 to 2012 from 60% to 30%. Section 8 housing is a typical go-to for people who can't afford to live anywhere. You can notice that there's a huge increase in the waiting list and there's just not enough of resources available. However, the available shelters in Columbia, Missouri are listed above. True North is a women's shelter for survivors of domestic violence. The picture on the corner is St. Francis, which houses adult men. Rainbow House is for adolescents in transitional housing. Welcome Home is for the veterans, and Salvation Army is permanent housing for everyone, kids, women, and families. Although it seemed like no one really wanted to quit when we were out in public and in the community, there is a downward trend and we're getting closer to our Healthy People 2020 goal. Field Park was across the street from St. Francis. It was where a lot of the socializing occurred, but also a lot of smoking was happening. The participant also admitted that a lot of drug trades happened there. One of the programs offered in Wilkes Methodist Church over downtown area was Turning Point, which basically provides the needs for the people who are homeless, and we're really able to get to know the people here. Missouri Tobacco Quit Line offers free help through counseling and hotline availability. Missouri HealthNet, aka Medicaid, and the Department of Social Services provides free access to nicotine patches and gum if they're trying to quit.
Population for our community's project. Many of the people did not want to be photographed or filmed with their responses, but they indicated that it would be okay to share their stories. So the majority of the people there smoke, that we sampled and that we asked questions to do smoke cigarettes. A lot of them didn't have a particular kind of cigarette they smoked. Some people mentioned Marlboros, Newports, and cigarettes like that. They just kind of smoke whatever kind of cigarettes they can get their hands on. Some of them told us they buy them from the gas station or the liquor stores. And sometimes they said that the majority of them hand out their cigarettes in the park so they don't get to smoke them as much. Other people said that they didn't smoke cigarettes at all. They preferred to drink alcohol. While we were there, we actually saw an intoxicated person during our sampling. in our interviewing. He didn't want to talk about it. But overall, about half of the people we talk to don't smoke and half of them do, or they prefer other kind of recreational activities. The reason behind smoking for some people was to relax, to get rid of the daily stresses. Some people just enjoy smoking, I guess, was really much the consensus that I got from speaking with them. Other people said that it was a habit they picked up when they were like 13, 14, really young, and it just stuck with them throughout the rest of their life, and it's just a habit they feel like they can't break. Some people said they were trying to stop smoking, but it just hasn't stuck. Nobody really mentioned like any interventions like nicotine patches or just going to like support groups or anything like that to help them with not smoking or using extracurricular illicit drugs or alcohol. So that was pretty much just our overall opinion and stories that they told us about their particular way of how they began to smoke. A lot of times they kind of wanted to talk more about their situation in general, just like how they came to become homeless, why they're homeless still, and what they're trying to do to not be homeless anymore.
Good morning, and there were about a group of 4 to 5 men sitting on a curb. I wasn't able to get a picture of them, but I was able to talk to them for a little while. And what I got from them was that they were really a family. They were all sharing one sandwich, and they were passing it down the line, making its way around until it hit everybody, which was really, in my opinion, pretty nice of them. Because in my initial, the initial impression I thought I was going to have was that everybody was on their own and they were fending for themselves, and it was just being more of like a selfish survival. But it wasn't like that at all. I thought that was pretty interesting and worth noting, because as we're doing this entire project, it's just like, how did they get there? And we're asking all these questions and this and this, and we're just forgetting that they're human. We almost forgot that they were human for a while. So just to restore the humanity in this population, they are very nice individuals. Just dealt with the different pain we have been. So I had a great time getting to know some of these people, and I would suggest that another group for the next semester go out to get to know them some more as well.